Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently just 7 o'clock on Wednesday, July 1st. And I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, are the facts in for a COVID surge? And I'll get to that in just a few minutes. What we do since beginning of March when I started doing these is to touch base on the current number of COVID cases just to see where things are. Because again, the COVID situation is the main thing that's really affecting most everybody's situation at this point in time. Right now, the current number of COVID cases is 2,658,000. Okay, that's up 35,000 new cases since yesterday. Now, the number of deaths is at 127,681. That's about 420 people have died since yesterday this time. New York State still is the number one state for the number of cases, and they have 394,000 cases right now. That's up basically 535 since yesterday. Their deaths right now, total since this got started, is 32,040. That's just 8 people that have died since yesterday. And again, yesterday's number was a little strange. And I think they've corrected things. I'm not certain, but the numbers for today show that there's a difference of 8 people that have passed on from yesterday. Now, California has taken the number 2 spot from about a week and a half ago or so. Right now, their numbers are at 232,000. They're up 5.6 thousand cases since yesterday. 5.6 thousand cases overnight in California. Now, the deaths in California are at 6,089, and they're up 101 people have died in California since yesterday, which is not obnoxious. It's a big state. But again, if you're one of those 101, they're part of your family. They're one of your coworkers or your relatives or neighbor. It affects you. Now, the number 3 spots is New Jersey. Again, New Jersey dropped to number 3 last week before. Texas is at number 4, followed by Florida, Illinois, Massachusetts at 7. Pennsylvania dropped to number 8. Georgia has moved up to number 9, and Arizona has moved up to number 10. Now, the case totals are just jumping all over the place right now. The death total right now is probably double what it was just 2 months ago, and it's really predicted to hit 180,000 people are projected to die by October. Now, there's still no treatment. Dexamethasone, again, the generic steroid, is fine. That's working if you're actually on a ventilator or you're oxygen dependent. It's shown to really improve your results considerably. If you're not, however, ventilator dependent or oxygen dependent, it has basically no effect for you. Now, if they end up with a vaccine, okay, because there's mixed messages on that right now. There's a lot of mixed messages been going on in this country for the last 3 years or so. But if they end up with a vaccine before the end of the year, its effectiveness is really going to be highly questionable. They haven't had a chance to test this. So we'll see what happens with that. Now, things continue to be exceptionally busy. Okay. Reports are in from various services that the Russians were placing bounties on American servicemen and servicewomen in Afghanistan. It's also reported that John Bolton said he personally briefed the president in early 2019 concerning the situation. Now, people in the intelligence communities and the military, as well as the families, are absolutely outraged that this actually happened at all. Select members of Congress just got classified briefings late yesterday and today. So we'll see what happens with that. The stock market closed down just a little bit today, nothing dramatic, 25.7 thereabouts. Okay, and it's going to just bouncing around that area. Interesting point today, San Francisco Federal Reserve Bank President Mary Daly, she made some statements concerning the pandemic, and she said the U.S. economic outlook is, in her estimate, the best case scenario, unemployment will still top 10% at year's end and won't return to previous pre-crisis levels for 4 to 5 years. That's a big statement from the president of a Federal Reserve Bank. Now, she went on to say, if we can get the public health issues under control, either through a really robust mitigation strategy or a vaccine, then we can re-engage the economic activity really quickly. And then it could just take 4 or 5 years. But if we end up with a more pervasive, lasting hit to the economy, it could take longer. Now, the numbers of coronavirus infections in the U.S. have surged in the last month. I mentioned some of this yesterday. I went down some of the states, and this has happened as the states try to relax their quarantine rules and really try to reopen their economies. Right now, more than 47,000 cases were announced across the United States just on Tuesday, yesterday. Okay. The most of any day in the pandemic ever. Now, officials in 8 states, Alaska, Arizona, California, Georgia, Idaho, Oklahoma, South Carolina, and Texas, also announced single-day highs. Tuesday was the 4th time in a week that the U.S. posted a new single-day case record. These numbers are going off the wall at this point. Now, the numbers of new cases in the United States has shot up by 80% in just the last 2 weeks, according to the New York Times. Now, health officials are nervously eyeing the 4th of July weekend amid the current surge. Now, some beaches, including South Florida, Los Angeles, have been closed. Other oceanfront destinations have really not. Health experts are actually pleading with Americans to take the pandemic seriously before it's too late. Right now, more than 46,000 new cases of the virus were announced in Arizona. I'm sorry, 4,600. By far, it's the most single in a day. Now, Vice President Pence was planning on traveling here today. More than 7,800 new cases were announced across California and more than 6,800 in Texas. Now, the increase in infections came as the leader of the most populous counties in Texas pleaded with Governor Greg Abbott to allow them to issue stay-at-home orders. He's in no rush for that. California's case count has exploded in recent days, leading the governors of New York and New Jersey and Connecticut to tell travelers from California to quarantine for 14 days, join the ranks of travelers from other hard-hit states. They weren't going to do that originally. It was just, some states, but California's just popped the numbers right up there. Now, even in states that had reported improvements are starting to see the numbers of new cases rise, causing governors to really rethink their plans to get residents back to work. Now, in the Midwest, they were on a vacation for quite a while, and they looked like a good spot because nothing was really happening there. Right now, they're seeing a major resurgence in coronavirus cases, even in places where the numbers had remained mostly flat, like Illinois and Minnesota. New hotspots have popped up in those states. Now, the record comes as Dr. Anthony Fauci, the nation's top infectious disease expert, testified before Congress yesterday that the rate of new coronavirus infections could more than double to 1,000 a day, 100,000 a day, if the current outbreaks are really not contained. Now, he warned that the virus is, the march is going right through the South and through the West, puts the entire country at risk. Now, Dr. Fauci offered this really grim prediction while testifying on Capitol Hill, telling the senators that no region of the country is really safe from the virus's reemergence. Now, Dr. Fauci said that, I can't make an accurate prediction, but it's going to be very disturbing. I will guarantee you that, because when you have an outbreak in one part of the country, even though other parts of the country are doing well, they're all vulnerable. Now, again, they're all connected, and we travel around quite a bit. So just one person can really affect a lot of people. And right now, Americans' concerns about the healthcare system itself, the capacity to treat COVID cases, as well as the testing spike that happened in late June, are really plateauing earlier in this month. According to new polling from Gallup, just today in Phoenix, the Quality's healthcare system, first free coronavirus testing in June was by open invitation. The healthcare system expected 500 to 600 people. Instead, more than 1,000 showed up in lines of cars that stretched for miles. The event was supposed to end at 11 a.m. Medical workers and volunteers administered nose swabs until they ran out, 7 hours later. Now, the percentage of Americans saying they're either moderately or very worried about access to hospital supplies, treatments, and services in their area grew by 10 points between on June 22 and June 28. However, 6 months into the nation's battle for coronavirus, doctors and nurses still face inadequate supplies of coronavirus supplies as the cases rise nationwide. Nearly 45% of those surveyed by the American Nurses Association said they experienced protective gear shortages as late as May 31. Almost 80% said their employers encouraged or actually required them to reuse disposable equipment. Now, the recent spike in coronavirus infections has really been fueled in large part by Americans just ignoring public health guidelines to keep their distance and wear masks. And that was according to a government infectious disease expert. Now, President Donald Trump himself was pressured to lead by example, although that's not happening anytime quick. Now, one of the longstanding quirks of Donald Trump's presidency is how he really feels the need to broadcast, and what he thinks just comes right out of his mouth, and it's on those tweets constantly. Now, people around him try to, corral him to some degree, but it's just not happening. They often try to guide the president with the policies, but he takes his lead by Fox News for the most part. And he's tweeting things constantly. And you just can't handle it privately. People have tried. Hasn't worked out at all. And that's what appears to be happening right now with masks and coronavirus. President Trump has steadfastly refused to urge people to wear masks, repeatedly stressing it's voluntary and even casting doubt on the efficacy, whether it actually worked or not. But in recent days, as the U.S. coronavirus cases surge, there has been a massive uptick in high-ranking Republicans offering a much, much more forceful case for them, including making arguments that seem intended for the audience of one, that masks actually help the country to reopen. Now, Fox News host Sean Hannity, who definitely has the president's ear, he offered such a message just on Monday night. He said, "I went to my grocery store every week. Guess what? They wore masks." That's what he said. "Nobody at my grocery store, thank God, got coronavirus. I think they work." And I said, especially if I wear a mask and if it opens up baseball, concerts, NFL, I'd rather wear a mask and go to a game and protect grandma and grandpa, mom and dad, and watch the ball game. Now, Hannity went and added, "I'll wear a mask. I just wanted to go to the game. It's a short period of time." This is Sean Hannity now. Now, Senator Mitch McConnell, from Kentucky, on Monday, offered his most powerful comments to date on masks. On the Senate floor, "We must have no stigma, none, about wearing masks when we leave our homes and come near other people. Wearing simple face coverings is not about protecting ourselves. It's about protecting everyone we encounter." Now, Fox and Friends host Steve Doocy also had an apparent message for his show's number one top fan, which happens to be the president. And he said on Tuesday morning, "I think that if the president were one, it would just set a good example. He'd be a good role model. I don't see any downside to the president wearing a mask in public." These are top people right now. Here's what a few other people had to say. Top Republican and Trump allies said about wearing masks in just recent days. Senator Mark Rubio from Florida, "Everyone should wear a damn mask." Senator Scott from Florida, we've got to do this. Every one of us, to take this seriously, wear your mask, social distance." In Texas, Governor Greg Abbott. I know some people think wearing a mask is inconvenient or an infringement on freedom, but I also know it will help keep Texas open, although he hasn't required them yet. Arizona, Governor Doug Ducey concluded in his remarks on Monday, emphasizing, arm yourself with a mask. It's your best defense against this virus. Senator Tim Scott from South Carolina, I'm encouraging everyone to wear your masks. Representative Liz Cheney, okay, the number 3 ranking Republican, okay, tweeted an image of her father, former Vice President Dick Cheney, wearing a mask with a hashtag, real men wear masks. It was all over the internet the other day. Senator Lamar Alexander from Tennessee. The president has plenty of admirers. They would follow his lead if it would help end this political debate. The stakes are too high for this political debate about pro-Trump, anti-Trump masks to continue. Now, the minority leader, Kevin McCarthy from California. Okay, I do not want to shut the economy back down. Wearing the mask is the best opportunity for us to keep the economy open, keeping us working, keeping us safe, and helping us as we build towards that vaccine where we're in a much stronger position than any other country before. Now, the last message is one that should logically appeal to Trump, but so far it hasn't really compelled him. Even the Vice President Pence has adjusted his tone. He declined an opportunity to urge people to wear masks on Friday, okay, during a coronavirus briefing, but then reversed himself on Sunday. Trump is still a holdout, though. Now, the White House press secretary, Carly McEnany, was asked in Monday's news briefing about Trump's stance on wearing a mask and what was going on with that. So she said, and I quote, "So I talked to the president before coming out here. It's the personal choice of any individual whether to wear a mask or not. He encourages people to make whatever decision is best for their safety, but did not say to me he has no problems with masks and to do whatever your local jurisdictions request of you." That's what she said. Now, Trump just continues to say what he wants, to have people make their own decisions, and he has no problems with masks. This is the latest in a long line of attempts to avoid taking a firm stance. He double talks constantly. Now, that could be because Trump loves the culture war that he continues to stir up, or because he has doubts about masks, or even because he just doesn't want to give in to the pressure, as he previously alluded to. But there's a practical effect, and it's all the same. And it's clear that it's beginning to wear on Trump's fellow Republicans, who recognize how simple it would be for Trump to just send this important message. But some Trump allies, okay, they think this is nitpicking. And they have to no further than Alexander's comments on Tuesday. Many people are declining to do this, but they would probably follow Trump's lead. Given the fast increasing pleas from Alexander and his fellow Republicans, the longer Trump holds out, the more conspicuous it will be. Now, that really brings me to today's question, okay? Are there facts and a COVID surge? Are the facts in for a COVID surge? Now, you may think this is going in the wrong direction, depending on what your political beliefs are, what your personal experience happen to be. Okay, you could be right or wrong. Was the president briefed by John Bolton in 2019 about the Russians putting a bounty on U.S. servicemen and women in Afghanistan? I don't know. I wasn't there. Okay. But the only people denying that right now are the president and the Russians. Is the economy as bad as people make it sound? I don't know. I'm retired. I've been relatively unaffected. However, both the federal government and the state governments are reporting record unemployment claims for months right now. Is coronavirus really real at all? I don't know. I personally haven't been sick, although I do know a number of people that were. Now, are the number of COVID cases real? I don't know. However, I have seen interviews of totally exhausted healthcare workers in New York, and I remember my days as a registered respiratory therapist when I was working in ICUs, CCUs, pediatric ICUs, and neonatal ICUs. When there was emergencies, I remember what happened. You got wiped out pretty quickly. Now, it looks real to me. Are the number of COVID deaths, are the actual deaths real at all? I don't know. However, I do know of a number of people that have died. I saw refrigerated trucks outside New York City hospitals because of the overflow of dead bodies. They couldn't store them in the hospital morgues anymore. They put them in container trucks. Now, do masks help slow down the spread of COVID? I don't know. I personally didn't do any testing to confirm it. However, I do have over 10 years in healthcare as a registered respiratory therapist, working in various clinical settings in a university medical center. Okay. I was a clinical instructor for a while. I'd have to say yes. Now, if I was one of my clients right now, when I was working with clients, I'd have two really, really basic questions. Okay. Am I going to get through this at all? And can I still retire at some point before I die? Now, the answer to the first question is pretty easy. We've all been through things that at the time we thought were absolutely terrible, and we just didn't know if we were going to survive or not. But we did. And the chances are pretty good that you'll survive this too. Without a doubt, it's going to be inconvenient. It has been inconvenient. It's going to continue to be that way. But chances are you're going to survive. Now, the second question, that was a bit more challenging. And it's really, really up to how you end up to answer that question yourself. If before all this nonsense got started, you had some basics in place, you had some vision for what you wanted to do in retirement, you had some idea of what it was actually going to cost you, and you already had some savings set aside for retirement, even if you were pretty certain that it wasn't really going to be enough, then there's a chance, okay, if you make a few changes today, that you'll be close to okay if you don't mind working well into your 80s and cutting back on your lifestyle considerably. Now, that assumes that you don't have any unforeseen financial or health crisis between now and then. Now, if, however, you like the idea of having the ability to retire sometime within the next 3 to 5 years with the cash flow that you'll actually need to do the things you want to do without having to worry about a job or the money or the market crashing, then maybe I can help you with that. Go to my site, drrousenow.com. Take a look at the 12-minute video there. It explains what I've come up with over the years. Again, the program took me over 10 years, over $350,000 of my money, and it might help you. Take a peek and you think. You look at it, let me know what you think. I don't twist arms. Again, I'm retired. If I can help you, that's fine. If not, that's okay too. Again, I'm Dr. Fred Rouse, the Real Money Doctor. My only goal is to help you get, protect, and enjoy your money, your life, and your retirement. This program has helped other people. I can't help everyone, but if you're listening, I may be able to help you. Go there, drrousenow.com. Take a look at the video. Let me know what you think. Schedule a call. We can chat. You can't buy anything on the call. I'm not selling anything on the call. I just want to see, do you really have a need or not? If you do, can I actually help you or not? And 3, do I think we can actually work together? So here we are. We're pretty much finished the show at this point in time. I'm going to post this video tomorrow on my YouTube channel, The Real Money Doctor. Like and share the video there. Make some comments there. Like and share the video here on Facebook and make some comments there. Again, if I can help you, I'd be glad to talk to you to see if I can. And if not, I wish you the best of luck. I've enjoyed spending some time with you tonight. And hopefully I'll be able to spend some time with you again tomorrow around 7 o'clock. Thank you.